A new infectious agent is spreading throughout America, and unfortunately, Texas leads the nation in new cases. The disease is due to a fungus called Candida, which was first identified in 2009 and more recently has become more prominent and more difficult to treat. Our medical expert, Dr. David Winter from Baylor Scott & White, joins us to discuss this. Dr. Winter, good morning.
Good morning, Morgan. Good to be with you.
Let's get right into this. Can you tell us about this new infectious disease and just how dangerous is it?
Yeah, it's called Candida or Candida auris. Now, auris is a Latin term for ear because that's where it was first found. Actually, let me show you with my model. Here's the ear canal, and here's the eardrum. This is where it was found first back in 2009. That can exist anywhere on the skin. So it's not just in the ear, but that's the name that's kind of stuck since 2009.
Can you tell me about some of the symptoms for this new disease? What are we looking for?
Yeah, typically if it's on the skin of a healthy person or in the ear canal of a healthy person, it causes no symptoms. But if somebody is frail, if they're old, if they have some immune deficiency problem, it can get into a wound or into the bloodstream. There it can cause a really bad infection, just like a bacterial infection. That's chills, fever, a lot of fatigue, your heart rate goes up, your blood pressure goes down, you're lightheaded. You can get pretty sick with this if you're frail to begin with.
And as far as getting a diagnosis, how is this condition diagnosed?
Yeah, you get it from blood cultures. Now you need to specify because not all blood cultures include fungus, and not all fungus cultures look at this one. So you have to specify that when you talk to the laboratory. So we're putting the word out to the doctors that be careful when you're trying to diagnose this because it can be a little tricky with the diagnosis.
You know, anytime we hear a headline like this, something new that's popping up, it can be really concerning. If someone is dealing with this, what are the treatment options that are currently available?
Yeah, and let me emphasize again, if you're healthy, you're not likely to get sick with this. You may have it on your skin, we might find it there, but it's not going to cause any disease. These are folks that are in nursing homes, maybe in a long-term hospital stay, maybe have some immunodeficiency problem, and those folks can get very, very sick with this. But there's good medicines for it. It can be treated. It can maybe go away. So a new thing we're learning about, and we'll be able to take care of this, I think, but most of us don't need to worry about this at all.
That's such comforting information, Dr. Winter, because again, you know, when we hear new and we hear spreading and, you know, being in Texas at the top of the list, that doesn't feel good.
Exactly.
So thank you for that advice. We appreciate it.
Right. You bet. Thank you, Morgan.